Hello, my name is Molly Mathistad, and this presentation will focus on why physical therapy should be implemented over opioids for treating musculoskeletal pain. So what are opioids? Opioids are a class of drugs that are commonly prescribed by physicians to patients for the treatment of pain. They are a tightly controlled drug class because of their high potential for abuse and can often be found circulating illegally on the streets. Just a few examples of some opioid drugs are morphine, Percocet, hydrocodone, and Suboxone. We have an epidemic in the USA right now that's been brewing for decades. In 2018, 10.3 million people misused prescription opioids, whether that be taking their prescription incorrectly, selling their prescriptions on the streets, or buying opioids that were not prescribed to them. 2 out of 3 drug overdose deaths in 2018 involved an opioid, and of those deaths, 36% of cases involved opioids that were prescribed by a physician. So these numbers aren't just referencing people who use drugs off the street. Many people who die of overdose were just taking their prescriptions correctly or had developed a substance use disorder from a legitimate prescription. Why do we see numbers this huge, and why are they growing? The answer is that opioids have been more and more frequently prescribed to treat pain in the US, and they can be highly addictive. Addiction is a brain disease characterized by compulsive substance use despite harmful consequences. People can become addicted to alcohol, prescription drugs, tobacco, street drugs, and many other substances. Substance use disorder is a chronic progressive brain disease characterized by a spectrum of behavioral patterns regarding the use of drugs or alcohol. And I say that it's a brain disease because it changes the wiring of the brain. So who develops a substance use disorder? The answer is people from all walks of life. Addiction doesn't discriminate based on race, income, age, or culture, and it can happen to anyone. Drugs like opioids work by hijacking the brain's natural reward systems and cranking them all the way up. So the brain has natural reward centers, and whenever you eat tasty food, finish a great run, or hug someone you love, your brain releases dopamine and you feel pleasure. This reward system helps us to survive. It drives us to repeat actions that feel good and keep us alive. When you use a drug, much higher levels of dopamine are released, flooding the system and overactivating your normal reward circuits. This extra strong stimulation of your brain's reward pathways causes a feeling of euphoria or a high. Now, your body is always trying to maintain its normal state. So when you repeatedly overactivate this system by using drugs, your brain will adapt by decreasing its ability to respond to all of that extra dopamine as a means of protecting itself. And that's really important to understand because now your brain circuits have made changes to protect themselves. And those changes will make it difficult for you to feel pleasure from normal everyday activities because those activities only release a normal amount of dopamine, and your brain is now adapted to need a much higher dose. This heightened sense of pleasure from repeated drug use gets recorded away in your brain's memory bank, and you become motivated to seek out that same huge reward again by using that drug over and over. Over time, this altered reward pathway becomes more and more well-traveled and can cause changes in even other parts of the brain responsible for decision-making and self-control, making it all the more difficult to stop the use of that drug and others. So how does this all relate back to the opioid epidemic? In recent years, we've seen a dramatic increase in the prescription of opioids to manage acute and chronic musculoskeletal pain. But unfortunately, there's little evidence to support the treatment of chronic musculoskeletal pain with opioids, and certainly not in light of the risks. Opioids can be highly addictive and dangerous. 1 in 4 patients prescribed an opioid drug by their doctor will go on to develop substance use disorder and abuse drugs chronically. Many people become addicted without ever even knowing it until they experience withdrawal symptoms when their prescription runs out. With chronic use, opioid receptors adapt and the brain is rewired to function with the input of the drug. Reward systems are altered, causing cravings that can lead to dependency and addiction. On top of these serious risks, there's also a lack of evidence supporting long-term effectiveness of opioids for treating chronic non-cancer pain. Chronic opioid use can also result in a condition called opioid-induced hyperalgesia in some people. Despite the fact that these people were likely taking opioids to relieve their pain in their bodies already, this condition makes them much more sensitive to painful stimuli and even can create new sources of pain. But the good news is that opioid receptors can readapt when given the chance by tapering off opioids, receiving education about pain by experts in pain neuroscience, and receiving therapeutic exercise prescribed by movement experts. So, who should we look to first for the treatment of musculoskeletal pain? The answer is physical therapists. Physical therapists are movement experts who optimize quality of life through prescribed exercise, hands-on care, and patient education. They are licensed healthcare professionals who create individual treatment plans for patients to promote the ability to move, reduce pain, restore function, and prevent disability. And they play an important role in prevention care, rehabilitation, and treatment for patients with chronic conditions, illnesses, or injuries. Physical therapists are experts in the neuroscience of pain, the physiology of healing, pathologies of the neurological, muscular, and skeletal systems, therapeutic exercise, and health promotion and wellness. Perhaps the most important expertise of physical therapists is in designing therapeutic exercise programs for patients with health concerns and injuries, and educating and empowering patients to develop good habits surrounding regular physical activity, which improves mood and health, is a healthy coping mechanism for life stressors, and gives people a concrete and healthy way to take back control of their pain. So how do physical therapists fit into pain treatment? A survey of 6,200 Americans revealed that 78% would prefer to try non-pharmaceutical pain management before taking prescribed pain medication, among other benefits of receiving physical therapy care first for musculoskeletal conditions. These skills, qualifications, and data point to physical therapists as the best choice for treatment of musculoskeletal pain. An article published in the Journal of Orthopedic Sports Physical Therapy summed up the many benefits which PTs have to offer to the opioid epidemic nicely. The knowledge and skill of physical therapists, combined with the amount of time we spend with patients, place our profession in an ideal position to not only pluck individuals from the river of chronic pain, but to also prevent them from falling into the river in the first place. So the bottom line of all this is not that your doctor necessarily shouldn't be prescribing you opioids. There are appropriate cases where the benefits do outweigh the risks. Every treatment method for every medical condition has both risks and benefits. Before worrying about opioids and deciding if they're right for you, talk to your doctor. They'll be able to discuss with you the specific benefits and risks of taking opioids for your particular case. The real bottom line is to educate patients, healthcare professionals, and community members about the immense benefits that physical therapists have to offer in combating the opioid epidemic. Physical therapists are experts in movement and musculoskeletal pain and should always be implemented in the first line of care for musculoskeletal pain before riskier treatment options like opioid prescription are considered. Thank you.